So in today's session, we'll be doing the topic of gastrointestinal diseases, not from the textbook. Okay. Anyone who is joining for the first time, these topics are not from the textbook. These are just additional classes just to make you understand certain medical terminologies, these common diseases, okay, basics of human anatomy and all. Okay. If anyone is joining late, please help them out with the topic name. So gastrointestinal diseases or GI diseases in short. Okay, the digestive system is made up of your GI tract, gastrointestinal tract. Okay, that starts from your mouth, ends at your anus. Okay, so that's everything is one single tract. Okay, one way. Then along with that, other organs also are involved in your GI system. These are the liver, pancreas, gallbladder. Okay, they all help the body digest food because they produce certain enzymes, bile salts, enzymes, some juices, and all that helps in digestion. Okay, so digestion is an important. It is important for breaking down food into nutrients. Okay, which your body can use for energy, growth, repair, etc. Okay, so some digestive diseases and conditions are acute. They last only for a short time, and others can be chronic. Okay, certain acute diseases can also turn chronic. Chronic means long lasting. Acute is short term. Okay, so short term diseases, if they are not treated in the right way, okay, that can turn chronic. So there are two types of GI diseases: functional and structural. Functional means maybe certain juices are not produced, enzymes are not produced. Okay, functions of the organs associated with the gastrointestinal system, they fail to work properly, so those become functional diseases. Structural is that organs are functioning properly, there is nothing wrong, but structurally there could be some obstruction, some tear, okay, some scar, structurally something changed, okay, some tumor that is causing obstruction. So the structure of the GI system, how normal it should be, it is now abnormal structure. So because of that, the condition got aggravated. Okay, so there are two types of diseases. So functional diseases, the GI diseases are those in which the GI tract looks normal when examined, but it does not move properly. They don't work properly. Okay. And most of the common problems that affect the GI tract, it includes your colon and your rectum. Colon is your large intestine. Okay. And constipation, irritable bowel syndrome, nausea, gas, bloating, diarrhea. These are the examples of functional GI diseases. Okay. So what are the causes, main factors that can upset your tummy? Okay. It can upset your GI tract as well as its motility. Okay. So when you eat a diet that is quite low in fiber, okay, that could lead to GI issues. If you're not getting enough exercise, lack of physical activity, that could lead to motility issues, motion issues. Okay. Uh, Traveling or sudden change in your routine. Okay, you will not be able to pass the motion during your normal routine. Eating large amount of dairy products, especially if you're lactose intolerant and you eat a lot of dairy products, that could lead to motility issues. Okay. Then stress. Stress can also cause acidity, constipation. Okay. Resisting the urge to have a bowel movement. You may feel the urge to pass the feces, but maybe you are busy, maybe too lazy, don't want to rush to the bathroom. So you're resisting that urge. Okay. That could lead to hemorrhoids. And it may be because of hemorrhoids you do not want to go. because you think that if I now go to bathroom, I will bleed a lot. It's very aggravative. It is painful. I don't want to endure that pain, so I don't want to pass the motion. Okay, so that is resisting the urge to have a bowel movement. Overusing antidiarrheal medications. Okay, to stop the diarrhea, if you're abusing diarrheal medication, that could lead to constipation. Taking antacid, medicines that contain too much of calcium and aluminum. Okay, antacids can reduce the acidity level in your stomach, and if the stomach acid level are become too low, that can affect motility. Okay, certain medications like antidepressants, iron pills, that is supplements, okay, iron tablets, parasulfate tablets, some strong pain medications such as narcotics, okay, morphine and all, they come under strong pain medications. Okay, so if you are using these medications, that could also affect your stomach. Pregnancy, in pregnancy, structurally also a lot of change comes, okay. The entire GI tract is pushed upwards because of the growing uterus. Okay, so structurally everything is compressed and pushed upwards. So definitely the motility also reduces during pregnancy. So these are the factors, common factors that can lead to constipation or give some symptoms of an upset GI system. What are structural GI diseases? Those where your bowel looks normal upon examination and also it does not work properly. Okay. Sometimes you have to remove it surgically. Any abnormality that you find out, it has to be removed surgically. Okay. So some cancer, tumor that is causing obstruction, certain strictures. Strictures means your GI tract becomes very thin in certain areas and it widens in certain areas. Okay. Stenosis is also narrowing of your GI tract. Certain areas it becomes very narrow. The tube, GI tube, okay, it becomes very narrow. So it creates bottlenecks and hemorrhoids, diverticular disease, colon polyps, colon cancer, uh, inflammatory bowel disease. Each one of this we will discuss in detail. You will see the images, so you will understand what's going on. Okay. So constipation is a functional problem. It makes it hard for you to have a bowel movement or pass stools. Okay. And the stools are infrequent. There is no routine. Okay. And that too weekly on a daily basis, you should pass your bowel movement. That's the healthy body. At least once or twice or in 24 hours, you should pass your bowel movement. That's a sign of a healthy body. Okay, daily, as soon as you wake up, within 1 hour, if you're getting your bowel movement, means you are healthy. Okay, you are free from majority of the diseases, GI diseases. Okay, but if you are going to the loo at least once in 3 days, okay, if that is the way of your health, it is bad. Okay, so constipation is often related to inadequate roughage. Roughage means fiber. Another name for fiber is roughage. Okay, in your diet, or even if you're having fibrous food, enough fibrous food, but if there is some disruption in your routine, you are traveling somewhere, okay, uh, any unpredicted situation came up and your routine shifted completely, okay, these could lead to change in your uh, bowel movement as well. Okay, it can lead to constipation as well. So constipation causes you to strain during the bowel movement. You push hard to get the feces out of your body, and it may cause small, hard stools that are very difficult to that don't leave your body easily. You have to strain a lot on the commode. Okay, so that's constipation. So these are different types, okay, of these types determine are you passing a normal stool or not. Okay. So severe constipation is this type 1 where the feces are small, hard, separate lumps like nuts. Okay, they are difficult to pass. These are constipation. Other is sausage shape but very hard and lumpy. These can cause tear in your canal as well. Okay, that can lead to bleeding. Okay, type 3 and type 4 come under the normal category. Okay, they are easier to pass. That's a healthy stool as well. Type 5, they indicate urgency, indigestion and all. Type 6 and type 4 is diarrhea, okay, where clinical treatment is required. So you can treat constipation at home just by increasing the amount of fiber that you take, okay, and also the water that you have. Increase the fiber and water content in your diet, you can tackle constipation. And also get into some physical exercise. Okay, move your body frequently, exercise regularly. Moving your bowels when you have an urge, or like whenever you feel like you want to go to the bathroom, wherever you are, find a bathroom and don't resist the urge. Okay, that's how you train your bowels to get into a schedule. Okay, and if these treatment methods do not work, okay, drinking hot water instead of cold water also helps. Okay, or throughout the day, instead of having cold water, switch to lukewarm water, hot water. That also helps. So if these treatment methods don't work, laxatives can be useful. So first is IBS. Okay, so far is it clear, the basics? Is it clear to all? So IBS, irritable bowel syndrome. So here you can see your intestine has to contract, okay? Because peristalsis movement is what? Just imagine, you can see here this is abnormal contraction, but imagine if it was a normal contraction. When your intestinal muscle is contracting here, whatever content is here, it should go forward. Okay, it is pushed forward. And this forward area will also contract. It will further get pushed forward. Okay, the contents of the intestine. This is how the entire peristalsis movement works from your esophagus till your anus. Okay, there is a peristalsis movement. It's a wave-like movement. Okay, one part will contract and it will propel the food forwards. Okay, and that part will also contract. It will further propel the food forwards. So this is a normal peristalsis movement. It happens in waves. Okay, waves means when one side is contracting, the front part of it should be relaxed. Okay, it's a wave-like movement. That is peristalsis movement. Okay, but in irritable bowel syndrome, there is abnormal contraction. It's not like waves. Okay, anywhere the contraction can happen, even if food is present there or not. Okay, even if there are certain contents in that area or not, doesn't matter. Irritable bowel syndrome can happen. Okay, that is abnormal contractions happening throughout your large intestine. Okay, that is IBS, irritable bowel syndrome. So it is also, there are other names for it. Okay, spastic colon. Spasm means what? Spasm is also irregular contraction. Okay, in periods, when women undergo periods, you have uterine spasms. Okay, irregular contraction of your uterus that leads to pain. Okay, so spasm means irregular contractions. Okay, spastic colon means the intestine is contracting irregularly. Okay, large intestine. Colon means large intestine. Irritable colon, IBS, nervous stomach. These are the other names for it. Okay. And this is a functional condition where your intestinal muscles contract more or less often than normal. Normal is that wave, peristalsis movement that is in a wave form. That is a normal contraction. Okay. If it is happening, the frequency of this contraction is more than normal. Okay. You will always have the urgency to pass a stool. Okay. And if the contractions are happening less than normal, it will lead to constipation. Okay, so irritable bowel syndrome can either give you constipation or diarrhea. Depends upon the number of times your intestines are contracting. More the contraction, more will be the passage of feces. Less the contraction, it will lead to constipation. Okay, so certain foods, medicines, emotional stress, these are some factors that can trigger your IBS. Okay, abdominal pain, cramps. Okay, too much of gas formation, bloating, always have a sensation of bloating, change in your bowel habits like harder and looser and more urgent stools. Okay, constipation, diarrhea, these are very common. Constipation and diarrhea depends upon the number of times your intestine contracts. So how can you treat IBS at home? Okay, like apart, it has some medications that your gastroenterologist will give, but as a nutritionist or dietitian, what can you guide? Okay, so avoid excessive caffeine, avoid milk as well. Okay, dairy products has to be avoided because it is more frequently seen. IBS is more frequently seen in lactose intolerant people. Okay, so avoid milk completely. Okay, and sometimes the doctors will prescribe you the lactobacilli tablet. Okay, the probiotic tablet will be prescribed. So increasing the fiber in your diet, monitoring which food trigger your IBS, okay, and avoiding that food, minimizing the stress or learning different way to cope with stress. Stress can also give you IBS. You must know that even if you're anxious, if you're even if you're a normal person, you do not have anxiety disorder, okay, but whenever you feel stressed, okay, maybe it's during the exam time when you're students, okay, it's your exam day, okay, you feel the sensation to go to bathroom more frequently. Okay, so that is the effect of stress. Okay, so try to minimize stress or learn different ways to cope with stress, taking medicines as prescribed by your healthcare provider, avoiding dehydration and hydrating well throughout the day. Okay, getting high quality rest and sleep. Okay, so these all things you can follow at your home. Okay, medications will be prescribed by the doctors that you have to take on time. Okay, and certain food changes also you will have to do. They have not mentioned here. You have to avoid lactose. Okay, control the spice. Don't have too much of spicy, oily food. Okay, deep fried, oily food should be avoided. Okay, like how in India, how we say, try to follow more sattvic kind of a diet. Okay, it can include non-vegetarian food as well. Okay, sattvic diet means which is easy on the stomach. Okay, which is not uh, uh, too much tempered with too much of spices. Okay, too much of hot spices. Okay, that has to be avoided. Okay, and even if you're a non-vegetarian, instead of having fried chicken, you can go for 1 second. Am I audible now? Case is hemorrhoids. Okay, you call it piles as well. Okay, piles. There are different forms of it. Hemorrhoids are dilated veins in your anal canal, anus. Okay, and this is a structural disease. Okay, because the structure, the normal structure of the human anatomy is changing here. So it's a structural disease. Okay, because when this veins get distended, okay, they become big and they get filled with blood. Obviously, the veins will cause some kind of obstruction. Okay, so structural diseases usually they cause obstruction in the normal passage of the feces. Okay, they are caused by chronic access pressure from straining during the bowel movement. Okay, persistent diarrhea, and even during pregnancy. Okay, and even people who um, spent a lot of time on commode, okay, like scrolling, using mobile phone or reading on commode, without knowing you are spending a lot of time, okay, on the toilet seat. So that can also lead to hemorrhoids because of gravity, right? You do your bottom, the perineal area does not get um, when you're sitting on the on a western commode, okay, your perineal area does not have a support from beneath. Okay, only your butt cheeks have the support. The perineal area does not have the support. So because of gravity, okay, the blood rushes through towards the end of the veins and they get pooled there. And over time, when you get into this habit of spending a lot of time on the western commode, lot of blood pooling happens over the time because of gravity. The veins they cannot fight gravity as strongly like your arteries. Okay, so that's why leg swelling and all, it's very common. Okay, so the same phenomena happens here as well. Okay, a pooling of blood starts happening around your perineal region. Okay, and the veins that are there on your anus, they become strained, they get filled with blood, they distend, they get dilated, and that leads to hemorrhoids. Okay, and when you pass the stool, sometimes these veins are so distended that they will break. Okay, it will cause some tear on your veins and you will start bleeding. That's hemorrhoids. Okay, there are two types of hemorrhoids: internal hemorrhoids and external hemorrhoids. Internal hemorrhoids are the veins that are getting distended inside your anal canal. Okay, external is just outside the anus. Okay, outside the opening, that is external. Okay, so internal hemorrhoids, the blood vessels on the inside of the anal canal that get burst open. Okay, when they fall down into the anus, because they are supposed to be up there. Okay, they are supposed to be more inside, but it's because of the gravity, the weight of the blood that is pooling. Okay, slowly the veins also fall down into the anus. Okay, because you are straining a lot, you spent a lot of time on the commode. Okay, so they become irritated and they start when you're passing your feces, that if again if it is a constipation, okay, the constipated feces will cause wear and tear on the blood vessels as well. Okay, and they will start to bleed. Treatment: improving your bowel habits, such as eat the diet which avoids constipation so that you will not, the risk of bleeding is reduced. Okay, don't strain during the bowel movement. If you're having fiber rich diet, you don't have to give pressure a lot for the feces to come out. Okay, moving your bowels when you have the urge, don't resist the urge. And in from a healthcare perspective, there are some ligating bands, okay, that is stitches done to the prolapsed vein, okay, to eliminate the blood vessels from there. And also your healthcare provider will remove these prolapsed blood vessels surgically. It's painful, Okay. External hemorrhoids are the veins that lie just under the skin outside your anus. Okay. And that also the same way, because of gravity, blood pooling takes place. Okay. They become dense with blood that has pooled down. Okay. They also can burst and cause blood clots under the skin. Okay. And this is called pipe when there are blood clots under the skin. Okay, because they are not burst opening into the anal canal. Their veins are bursting, but the skin is not bursting because it's your butt cheeks. It's the end. It's the area near your anal opening, and your butt cheeks. Okay, so treatment includes just removing the clot under local anesthesia and removing the hemorrhoid itself. The distended vein itself can be removed under local anesthesia. Then you have anal fissures. Okay. Fissures are also structural disease. Something that is normal is not normal anymore. Okay. Anatomically. Okay. Like some muscular openings are there in your anal canal. There will be some split or some cracks in the lining of your anus. Usually it happens because always you're constipated or whenever you go to bathroom, it's constipation. Okay, and constipate and your anal cavity is also very delicate, very thin. Okay, and on top of that, if you are constipated again and again, this constipated stool can cause some abrasions from inside in your anal cavity. That leads to splits and cracks. Okay, so when when and this splits and cracks when it happens inside the cavity, okay, that leads to intense pain, bleeding as well. Okay, if blood vessels are also involved, it will lead to bleeding, spasm after bowel movements. Okay, after passing the feces, that area will undergo contraction and spasm. Okay, and usually uh, even if you're constipated or you are suffering from chronic diarrhea, okay, from the past 1 week or so it is diarrhea, and because of watery stools, okay, because of too much of watery stools, the watery stools also makes this area very tender. Okay, prone to cuts and cracks and splits. Okay, so that is anal fissure. So pain medications are given to treat this. Dietary, if you are suffering from constipation, then dietary fiber will be added. If you're suffering from chronic diarrhea, antidiarrheal medications will be given. Okay. Sitz bath is also given, that will give pain relief. Okay, and it can disinfect the area as well. Okay, it can be antiseptic in nature. If you are using some antiseptic solutions in your sitz bath, that could lead to uh, pain relief as well. Okay, what is sitz bath? It's a tub. It's a small the tubs that even you have at your home, but not the buckets. The tub, small tubs. Okay, small plastic tub that is filled with warm water and some antiseptic solution like Dettol, Saffron also can be used if you're doing it at home. And the person is made to sit in that, make sure that till their umbilicus, the perineal region is covered in water. Okay, it is underwater. It is immersed in water. Okay, so that is a sitz bath. So if these treatments don't relieve pain, surgery will be required to repair the fissure. Whatever is split from inside, it will be stitched. Okay, repair will be done surgically. Then you have perianal abscess. Abscess formation is pus formation. Okay, when a tiny anal gland that should be opening inside your anal cavity, if that becomes blocked, okay, there are anal glands that keep the anal cavity uh, well lubricated. Okay, it will, this anal glands, they secrete certain kinds of mucus to keep the anal cavity lubricated so that it helps in the easy passage of the feces. Okay, reasons, because of certain reasons, this anal glands can become blocked. Okay, maybe because of fissure which was near the opening of the anal gland. Okay, and that fissure led to feces getting stuck in the opening and blocking the gland. Okay, these things can happen. So what happens is that the gland is supposed to produce its mucus, and this toxin, this fluid, is not able to get out. It will stay inside and it will cause pus formation. Okay, so that is perineal abscess. So these glands will get infected because their fluid, which are supposed to be coming out, is now blocked. Okay. So in treatment, you will drain the abscess under local anesthesia. Then anal fistula. Fistula is an, am I audible to all? Is my voice breaking? Am I audible to all? Okay. Anal fistula is an abnormal opening. Okay. So this you can see here. This is an internal opening. Okay. This was not supposed to be here. Okay. Because of certain structural disintegrity. Okay. This opening happened, which was not supposed to happen. Okay. Here on the left side, you can see there should not be any opening. Okay, the skin here, the muscular region layers here should be intact. Okay, again and again some anal abscesses are taking place, or splits or cracks are happening here. Okay, that will lead to disintegrity of the muscular layer as well, and that would lead to some abnormal opening. Okay, so that and it what happens is that whenever the feces is passing through the rectum to the anal canal, some part of it can get into this anal abnormal openings. They can get stuck there. Okay. And that will lead to some infection, abscess, and all. Okay. So that is anal fistula. So anal fistula, again, it is a structural disease and often follows drainage of an abscess. Earlier, an abscess was there, and when the medical practitioners they drained out your abscess, okay, that can also lead to anal fistula. It's an abnormal tube-like passageway from the anal canal to a hole in the skin, okay, near the opening of your anus. So that is an abnormal pathway. And body waste can get trapped here. They can get diverted through this channel, get trapped here. And if the feces stay there for long term, it will cause irritation and infection. Okay. So this also has to be drained. It can be very painful. It can lead to bleeding, and this and anal fistulas also has to be drained out. It has to be stopped. They don't heal by themselves. Surgery is required to drain out the fistula and close off the fistula using stitches. Okay. Then you have diverticular disease called as diverticulosis. This is small outpouchings. You can see this here, bubble-like structure. This is small pouches, outpouchings. Okay. This each pouch is called diverticula. Okay. In the muscular wall of your large intestine, this outpouchings take place. because that muscle area is weak. Okay, when the intestinal muscles are weak, it will lead to this muscular outpouching. They usually occur in your sigmoid colon. This is the sigmoid colon. Okay, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and then you have the anus. This is the anatomy of the intestine. Okay, so usually sigmoid colon is the area more prone to diverticula. Okay, diverticulosis, it can progress into diverticulitis. How? When feces is passing through the descending colon and sigmoid colon, feces can get trapped in these pouches. Okay. And if the feces get trapped here, it will lead to inflammation, infection. And when there is an inflammation, it is itis. Okay. When the diverticula has an inflammation, it is diverticulitis. Okay. So treatment, you have to treat your constipation. Antibiotics will be given. If there is an infection, antibiotics will be given. Okay. And in severe cases, when there are too many diverticulars, severe cases, surgery will be required to cut off this out pouches and ligate the cut off areas. Okay. So that's surgical removal of diverticulars has to be done. Okay. Then you have colon polyps or cancer. Colon polyps which can turn into cancer. Okay. So fortunately, with advances in early detection and treatment, colorectal cancers is one of the most curable form of diseases. Okay. A lot of screening tests can be used here to prevent, detect, and also to treat this diseases long before the symptoms appear. Okay. Because colorectal cancer, it's hereditary. Okay. And also it is very common in communities which eat red meat a lot. Okay, red meat eating communities and non-vegetarians, they have the higher risk of developing colorectal cancer. So it usually starts as a colon polyps. Polyps means a small growth. Okay, it will usually have a stalk and a small growth inside the intestine. So usually polyps can cause a little bit of obstruction in your intestine. Okay, because this growth is reducing the space where your feces is supposed to travel. Okay, but if it is not treated or removed immediately, that can still keep on growing. It can develop into other stages. Okay, and it can become cancerous if it is spreading into the lymph nodes of this area. Peyer's patches are there in your intestinal region. Okay, these are lymph nodes, lymphatic tissues. Okay, so that will, if at all this cancerous polyps gets in contact with the lymph nodes, okay, it will become cancerous. First, it is non-cancerous. Usually polyps are benign and non-cancerous. Only when they grow in an abnormal level and they cross over stages of development, they become cancerous. And not just the intestine, they will start invading other organs as well, surrounding tissues as well. So when you remove the polyps, in this stage itself, when you are taking care of the polyps, you are preventing the risk of cancer. Okay. Then you have colitis, colitis. Okay. Intestine undergoes inflammation. So there are different types of colitis. Colitis is usually a symptom as well. Okay. It's not just a disease. In various gastrointestinal diseases, you get colitis as a symptom. Okay. So there are different types of colitis depending on what happened to your intestine. Okay. It could be infectious colitis. If you have some infection undergoing in your bowel system, it is infectious colitis. Ulcerative colitis, if there are ulcers in your intestine. or there are wounds in your intestine that are not healing. Okay, that leads to ulcerative colitis. Crohn's disease, okay, the entirety of your intestine is swollen, inflamed. Ischemic colitis, when because of some injury or because of some cancer around the area, the intestine is not getting enough blood. Certain areas of your intestine, blood flow is blocked. That leads to ischemic colitis. Radiation colitis, when cancerous patients who are undergoing radiotherapy for colon cancer, excessive radiation can also lead to inflammation. Okay. And when a person undergoes colitis, it leads to diarrhea, rectal bleeding, stomach pain. There is always an urgency to pass stool. Okay. Immediate need to empty the stomach, but usually nothing comes out. Okay. So biopsy is done, colonoscopy is done to diagnose this condition. Okay. Crohn's disease, it's a chronic disease. Okay. Usually it does not has any cure. Okay. You have to control the flare-ups. You should have a certain specific lifestyle in which your food and all, and also the stress management has to be done. Okay. Lot many lifestyle modification has to be done. Okay. So usually it does not have a treatment. Crohn's disease is long lasting. Okay. So this causes inflammation and irritation in your GI tract and throughout your intestine, not just large intestine, but even a small intestine can also undergo inflammation. Okay. So most common situations you see in Crohn's disease are diarrhea, cramping, pain, weight loss, because inflamed area will not be able to absorb nutrients. Okay, so that can push the person into malnutrition. So doctors treat Crohn's disease with medications. It's usually uh, steroids and all are used. Okay, non-inflammatory steroid medications are used here to control the inflammation, to decrease the inflammation, and also to prevent flare-ups. Okay, you have to follow some specific diet so that that does not lead to some allergic reactions and flare-up of inflammation. Okay, and to keep you in remission. Okay. So diet is usually high calorie, lactose free, and low fat diet. High calorie to make sure that there is not more weight loss. Then you have celiac disease. So celiac disease is also very rare. And this is the disease in which you should have gluten-free diet. Okay, gluten-free diet was made actually for celiac disease. Okay, so celiac disease is a chronic digestive disease. It's an immune disorder in which your immune cells start damaging your intestinal villi. Okay, and they consider wheat or gluten. Okay, they consider that as an allergen. Okay, and whenever you eat something that has gluten, your body goes into a flare-up. Okay, your intestine gets triggered. So this disease is triggered by eating food that has gluten. What is gluten? Gluten is a protein. Okay, it's commonly found in grains and certain cereals like rye, wheat, barley. Okay, rye, or they are certain certain forms of oats have gluten as well. Okay, so gluten-free diet is given here. So this is long lasting. You have to keep your body from getting all the nutrients it requires, except for giving it gluten-based diet. Okay. So here you can see in celiac disease how the normal intestinal villi it looks like. It's a long finger-like projection. Okay. In celiac disease, they get flattened. Okay. The intestinal villi, they undergo atrophy. Atrophy means they decrease in their size and number. Okay. Then lactose intolerance, very common. Okay, whenever you have something, any food that has lactose in it, okay, milk products, usually dairy products, that will lead to bloating excessive gas production, flatulence, feeling full always, lower abdominal pain, diarrhea, nausea, vomiting, constipation. These are the symptoms of lactose. Whenever you have some lactose-based food and this is how your body responds, it means you are lactose intolerant. Okay. So if you have lactose intolerance, you have digestive symptoms such as bloating, diarrhea, gas, just after you consume food or drinks that contain lactose. Okay. This can affect your health also, and also it can affect the absorption of other nutrients like calcium and vitamin D because they are rich in dairy products. And when you stop dairy products, your chances of getting calcium and vitamin D goes down. Okay, so you will have to, when you're substituting your uh, dairy-based products with non-dairy products, you have to make sure you are using fortified food. Okay, fortified substitutes are being used so that you get enough amount of calcium and vitamin D, which the natural products were supposed to give you. By changing your diet to limit or avoid food that contains lactose, you can control the symptoms of lactose intolerance. Okay. And also in certain cases, you if you're going out for a party, okay, once in a while you want to eat pizza or you want to indulge in some cheese, okay, you can have lactase based products. Okay, these are tablets. Lactase tablets also come. You can have that and then continue having um cheese, milk, milkshakes, ice creams, and all. Okay. Because lactase is an enzyme. Because your body cannot produce this enzyme, you are taking lactase based product. Okay. So that can help you break down lactose and manage symptoms for a short period of time. So that's about the common diseases that we see in your GI tract. There are others which we will discuss in the diet in GI diseases. If you have any queries,